We are very happy to have you watching this Preventing the Spread COVID-19 presentation this afternoon. We're very excited to introduce Anna Marshalick, a member of the Delaware County Chamber of Commerce, who's the Regional Director of Education. This is a perfect time for us to be learning the basics of how to prevent the spread of COVID-19 as the local business community continues to gradually work their way back into the workplace. And we really appreciate Anna joining us this morning to give us this critical information and make sure that we can safely and strategically re-enter the workplace. Anna, thank you so much for joining us. I will hand it over to you now.
Okay, thank you very much. Good morning, everyone. What I'm going to do is just take about 10 or 15 minutes and just review with you some very basic strategies that all of us can do each and every day to make sure we prevent the spread of COVID-19. As we know, businesses are beginning to open. We're getting ready soon to move to the yellow phase. So it is not time to give up on all of these great recommendations that have been given to us. If anything, it's a better time to really try to strengthen everything that we're doing to prevent the spread of COVID-19. So how is COVID-19 spread? We know COVID-19 is a disease, and it is caused by the coronavirus, and that virus is spread person to person. It is spread when people become close contact within 6 feet. We're all very aware of social distancing and that 6 feet guidance that has been given. And it is spread by respiratory droplets. So when somebody has this virus and viral shedding is occurring in their body, that is the time that it is transmitted through coughing and sneezing into the air. And those droplets can land also on surfaces, so they can be coughed out and someone can inhale them, or they can land and then you pick them up by touching them on a surface or an object, and the virus is still alive, but not for a very long period of time. What then happens if you touch your nose, your mouth, and your eyes, and they're not clean, then you can have that virus enter in your body. That is the only way the virus enters into our body. It's through our nose, our eyes, and our mouth. And as we know, we have people who are spreading the disease and not showing symptoms yet. Some people can have a very mild form of this, and others have the more serious form of the disease with the very profound respiratory complications. So the symptoms have changed over time, but this is the latest as the CDC is telling us. It's still the respiratory symptoms with the cough, the shortness of breath, the fever, the chills, muscle ache, sore throat, and a new loss of the sense of smell or taste. And generally, children have a milder form of this. It's older adults that really have the more profound form of this. And also people who have a lot of other illnesses like diabetes and heart disease. Also added to the list now are GI symptoms like nausea, vomiting, and diarrhea. And so as we continue to navigate COVID-19, we should continue to be very vigilant in our practices and follow the guidance of the CDC and also public health experts. And they are very basic things. Avoid close contact. Keep doing the social distancing. Don't touch your nose, your eyes, your mouth. Stay home if you're sick. Cover your coughs and sneezes with either your elbow or tissue. Clean and disinfect surfaces that are frequently touched. And I cannot stress the importance of hand hygiene. Most importantly, washing your hands with good old soap and water. There's some other things I'm going to cover today, but these are the basics, and I'm going to spend a lot of time on how important it is to properly hand wash. So what can you do? Wash your hands, wash them frequently. And if you don't have good old soap and water available, look for a hand sanitizer that has at least 60% alcohol, and most of them do, but make sure you check the label. Don't touch your eyes, your nose, and your mouth with unwashed hands, and wash your hands frequently. Why is hand washing so important? Because this virus, the coronavirus, is encapsulated or encased in a protein and a lipid or fat membrane around it. And nothing breaks down lipids, fats better than good old soap and water. And we all know this. If you've just prepared a dish, if you cook something in grease like bacon, if you put the liquid right into that, you can already see how that liquid soap begins to break down the fat. So the best thing that we can do for ourselves is frequently wash our hands with soap and water. What else can we do? We know it's spread by droplets in the air. If you're coughing or sneezing, make sure you cover your face, use a tissue, or sneeze into your elbow. And then if you do cough into a tissue or sneeze into tissue, throw it away immediately and then wash your hands. Also, we know it can land on surfaces, so you must clean and disinfect and do it frequently. Those of you who have businesses, really pay attention to your frequently touched surfaces, tabletops, countertops, handles, door handles, toilets, faucets, and your phones. If they're dirty, make sure you clean them first before you disinfect. Also, what are the disinfectants that work against this virus? If you want to check, the CDC has a list of all of the registered household products. The two that are very familiar to us are Clorox and Lysol, and they're on the list. The other thing that's very effective is diluted bleach and an alcohol solution that has 70% or greater alcohol in it. So check that list. There are 17 pages of products that do destroy this virus. When you are using a disinfectant, two things to bear in mind. You must make sure that you completely cover the surface, and you must make sure it has proper dwell time. And what that means is how long it must stay wet to be able to properly disinfect and kill whatever germs are on that surface. So read your labels. Some do that as quickly as 30 seconds. Other will take up to 5 and some even 10 minutes. Make sure you wear your cloth mask at all times when you're out in public. And we know that this went into effect in early April for the state of Pennsylvania. But there are some groups of children we must be careful with. Children, anyone under the age of 2, or if somebody is incapacitated or can't breathe while they have that mask on. And continue to wear that mask at all times. And also remember, it is not a substitute for social distancing. And again, in early April, it was mandated to wear the mask. I just want to throw a plea out there to please save surgical masks and N95 respirators for healthcare workers and first responders. There are procedure masks that are out there, which are not surgical masks. They're generally the paper masks that have the bands that go over your ears, and they're readily available now. They're different from a surgical mask. The surgical mask is much thicker, and it generally has the ties, which you can get a real tight fit on. And the N95 respirators are something very specific that should be used in healthcare only. And remember the saying, my mask protects you, your mask protects me. Hand washing. When should you do it? All the time. After you sneeze, cough, blow, or wipe your nose. Anytime you handle anything that could be dirty or contaminated. Before and after you eat, especially if you are going to be touching your food with your hands. Before and after you prepare food. If you smoke, make sure you wash your hands before and after you smoke. And there's a right way to wash your hands. You want to wet your hands thoroughly under running water and apply soap. Generously apply soap and lather your hands. Rub them, all surfaces, back of hands, front of hands, all the way up your wrists, in between your fingers and under your fingernails. Rub vigorously, and also make sure you do it for at least 20 seconds. Happy birthday times 2. And I'm telling people, go further, do it 3 times and go up for 30 seconds. Because remember, that coronavirus is destroyed by good old soap and water. Rinse your hands well, and then dry your hands with a clean paper towel. And if you don't have an automatic shut-off for your faucet, get another paper towel before you turn off the faucet. Because you turn that on with dirty hands, you don't want to be shutting it off with your clean hands and getting contaminated again. Hand sanitizers. If you can't use soap and water, make sure you go carry, honestly, I'm telling people, carry hand sanitizer with you and make sure it at least has 60% alcohol in it. And there's a right way to use hand sanitizer. You want to apply it in the palm of your hand, and then the same surfaces that I talked about that must be covered when you're washing your hands are what you cover with the sanitizer. Front, back, tops of your fingers, up to your wrists, and it's just like when you're disinfecting, that has to remain on your hands, cover all surfaces for at least 20 seconds, and never dry it with a paper towel. You're defeating the purpose of the hand sanitizer. Allow it to air dry. Cough etiquette. If you don't have a tissue, make sure you cough into the sleeve of your arm, and regardless of when you cough or where you cough into, after you dispose of your tissue or if you've coughed on the sleeve of your arm, please wash your hands. Very important. Gloves. If you're wearing gloves out there, there are some things that you need to know about them. There's a right way to use them. Gloves must be the right size. If you're using gloves that are too big, and germs can get underneath and inside the gloves. I see this all the time. Or gloves that are too small are likely to rip, and then you're exposing your skin anyway to pathogens. And if you have a latex allergy, make sure you're not using latex gloves. So choose your gloves wisely if you are using them. Gloves are supposed to be used for a single purpose, and the right way to wear them is so important. How many times have you seen this out there? Somebody's in the gloves, say example in the grocery store, they have those gloves on, they continue to keep them on, and then they're touching doorknobs, they're touching surfaces, they're touching their phone, and then while they're still wearing those gloves, they touch their face or rub their nose. And what they've done is anything they've picked up with those gloves, they've now introduced into their own system. So gloves are for single use, they are for a barrier. You should wash your hands before you put them on, before you take them off. And remember, if you're wearing them, the outside of that glove is contaminated. There's no right way to take them and put them on, but there is a very important, strict way to take them off. And this picture here demonstrates it for you. Remember, they're for single use. When you take them off, the right way to do it is you take off one of your gloves and then you ball it into your palm of your other hand, and then you take your fingers from the other hand and you gently pull it underneath that glove and pull it over the first glove that's in the palm of the hand. So you're bagging the gloves, and then you throw them away, and immediately after that's off, wash your hands. Masks. No matter what mask you're wearing, cloth or paper, you should wear it the correct way. The right way to wear a mask is to cover your nose and your mouth, because remember, that is where the pathogens can enter into your body. Masks are not to be used as a necklace or as a goatee, and not just to cover your mouth, they must also cover your nose. And putting on a face mask, there's a right way, whether you're putting on a cloth mask or whether you're putting on a paper mask. Wash your hands first. Or hand sanitizer. Make sure you know which is the right side of the mask. Not all masks are the same. Some of them have a colored front and a white inside. If you're using a cloth mask, see how it was made. Many of them were made with a little slit in it that is the back of the mask where you could put an extra filter in it. That belongs near your mouth. So look at your mask and make sure you're putting it on in the correct way. Most of the masks have ear loops, and you want to put it on in one fell swoop. If you have a cloth mask that you're tying on your face, just make sure that you're tying it tightly so you are covering your nose and your mouth. If you're wearing a paper mask, or even some of the cloth masks have that stiff edge that's over your nose, make sure that you mold that around your nose and that you pull the bottom of it over your chin. That is the correct way to wear a mask. And when you are wearing that mask, if you touch your face with that mask on, please make sure you wash your hands. And I find when I'm wearing my mask, it's a very good reminder for me not to touch my face. There's a right way to remove the mask. Remove your mask with clean hands. Avoid touching the front of your mask. Pull it off by the ear loops, or if it's a tie, untie them and pull it away from your face in one motion. After you remove your mask, you should clean your hands. You should also store your mask in a paper bag between use. However, the guidance from the CDC is any mask that is cloth, you should be laundering it daily. I have several masks and I do have a bag, and in between use, I put them in my bag, my paper bag, and then I wash them according to the instructions really on the product I'm using. But with a cloth mask, what you must do is it must go through the cycle in the dryer. That's an important part of laundering the mask. It must be fully dried. Paper masks cannot be reused like a cloth mask. They are one and done and they can't be laundered. So in summary, this wonderful guidance that has been given to all of us, we must continue to do this. We must continue to keep each other safe as we navigate this COVID-19 pandemic and as we begin to reopen. So continue to practice social distancing. Avoid touching your nose, your mouth, and your eyes. Stay home if you're sick. Cover coughs and sneezes. Disinfect and wash your hands. I cannot stress that enough. Washing your hands with soap and water will do it. Hand sanitizer, carry that, and remember 20 seconds for that as well. Cover all surfaces. Make sure that you do have your nose and your mouth fully protected by a mask. If you are coughing or sneezing, do it the right way. Dispose of the tissues and wash your hands. And if you're wearing gloves, remember to use them in the right way. I hope this has been very helpful information. All of this was based on reliable sources of truth out there. We should get our information from the CDC, our own Pennsylvania Department of Health, your own county Department of Health, the World Health Organization. Johns Hopkins is also another wonderful resource center, and the FDA also provides a lot of guidance for us. So thank you very much for your attention.
Thank you so much, Anna. I know that after this presentation, I feel more comfortable returning to the workplace. This critical information is something that we're very lucky to have, and coming from you, we just really appreciate you spending the time this morning. On behalf of the Delaware County Chamber of Commerce and also on behalf of the local business community, we just want to thank you, Mercy Home Health, and the entire Trinity Health System for joining us. This is something that we need. These reminders and this critical information is going to make sure that Delaware County comes back even stronger than we were before as we re-enter the workplace and we're in these unknown times. But this is something that's going to make sure that we're prepared and we're as safe as possible. So thank you so much. We truly appreciate it. And we look forward to you joining us again, hopefully sometime in the future.
My pleasure. Anytime. Thank you very much. Be safe out there.
Have a wonderful day.
Thank you.